Hello, and welcome to the Longev Lens. Please join my co-host, Dr. Sebastian Pedersen, and I as we cut through the noise and hype around longevity, health, and wellness, and turn the latest evidence into honest, practical insight for living better for longer.
And just a quick disclaimer before we dive in, this podcast is for educational purposes only and doesn't constitute medical advice. If you have a healthcare problem, please consult your doctor or qualified healthcare professional.
Welcome back to the Longev Lens, where we're going through our rapid fire segment today. And today we wanted to go through creatine. It's been a massively trending topic, especially this year, even though it's been around for well and truly 30, 40 years, probably even longer, especially in the performance and sporting world. But we wanted to bring together more of the newer evidence. And Dr. Seb, thank you again for joining me today. Because there is a lot of new evidence, especially in women, in menopause, in sleeplessness, in so many different avenues apart from just performance enhancement. So let's just start off with creatine. So what is it?
Pretty much an energy source. It's very good for all the energy systems or we talk about performance first, anything requiring energy without oxygen. So it's just a very good rapid fire fuel for the muscles and for the brain. And then exactly as you're right, you're saying it's very topical, especially with the cognitive or brain health and perimenopause and menopause, but also don't want to underappreciate the impact on muscular health, performance, athletic performance over a longer period of time. So if you increase creatine, you increase the creatine within muscles, within brain, thus more energy for the muscles and brain to do what they need to do. Thus, from a brain perspective, increased performance, and from a muscle perspective, increased performance. That said, though, it's most of the evidence within, if you want to just quickly go over the sporting performance world first, most of the evidence is for speed or power sports, so sprinting and lifting, which is a lot of evidence, but also it ultimately improves your strength. So what I use it for is I have probably changed the way I approach creatine within strength training for our clients and patients. I used to be more of the fact that start training first and then we can add creatine on later. Whereas now what I do, based especially on who we see, we want everyone to maximize their returns based on any investment they're putting into exercise. So as soon as the people start exercising, especially from a strength perspective, we do start them on creatine to thus improve their strength performance and thus overall function of trying to optimize their health span long term.
That's pretty cool. That's interesting because a lot of people might, like you would have done before, get started with the exercise first, then start to add new things in. Sort of like with, I guess the mindset is with even testosterone placement or like peptides or things. They just want to get these exogenous, like this external supplement or the peptide, whatever it might be first, and then go, I'll feel better. But yeah, creatine being that it is a naturally occurring source in our body already. We just need to replenish what we've already got. Is there sources of food that you can actually get creatine from?
You can, but it's not in the highest quantities that you really want. So you want, from a performance perspective, you can do a loading course first, so about 20 grams for 3 to 5 days, and then we're dropping it down to about 5 grams. So about 5 grams is sort of half a tablespoon. But in terms of actual use of creatine, I do find supplementation, so creatine monohydrate is much better.
Yeah, and it's also just very cheap.
Is exactly right.
We have had some, especially even clients of ours, they've had some issues with bloating. And like there's not too many adverse effects from creatine. It's been studied as really, for most people, quite safe. What sort of things are people, if they have bloating, what sort of things?
Gastrointestinal side effects can occur. I see it very rarely. So if you do have someone that potentially start at a lower dose and increase the dose quicker, increase the dose slower. So that they don't just start from 0 and going to a 20-gram loading dose. They may be starting at 2 to 3 grams and gradually increase. Other side effects, the main ones are kidney-related issues and heart-related issues, mostly due to fluid retention. Now, it's not massive, and most of the fluid that you retain after using creatine is most of the fluid in the cells, so not in the actual blood vessels. Why that's important.
How does that make a difference in terms of like kidney or heart function?
So if you have, the one important thing to get out first is it doesn't cause heart issues and doesn't cause kidney issues. But if you have pre-existing heart or kidney issues, then it can make things worse. Low risk, but something not to be missed and something to be mindful of. Good example, if you've got heart failure, so you're having trouble either filling your heart or contracting your heart, and thus you often have issues with too much fluid in your body, which is why you get swelling in the legs. If you then add creatine on top of that, so you're adding more fluid to the system, it makes it even harder for the heart to pump and do what it needs to do.
Interesting. Okay. Is that what you see when people look quite red and swollen in their legs?
It can be multiple causes, but
Yeah,
definitely heart failure could be one of the causes. Yeah.
Okay. Interesting. But it is a very cheap and accessible supplement too. Again, from a safety perspective, for most people, it's pretty good. You did mention before, I just want to touch on a little bit more of where and why you would actually use it, because it was more of it's not necessarily beneficial for like endurance type training or anything like that. It was more for like repeat sprints and
correct. And I use it
strength.
most exactly for what I see, if people are only putting in 2 or 3 sessions a week for strength training or resistance training, you really want to maximize return on investment. So adding creatine into that situation can maximize returns, maximize strength, and thus long-term maximize function, and thus prevent issues with functional impairment as you get older.
Yeah.
So that's the way that I use it. If people obviously are doing much more than that, it's still recommended, but it's just to make sure that they're not wasting any efforts exercising.
It can grow muscle. It's awesome for if in turn you're able to get more out of your training, you'll also be able to grow more bone. Some people are concerned with weight gain.
Yep.
How?
A lot of it is fluid related. Like it's not necessarily you're not putting on fat mass because of creatine. It is an energy substrate, so thus you're putting more energy into the system. And thus, if you're still adding the carbohydrates, proteins, fats, then yes, you have more calories all of a sudden.
Because this year being a bit more topical with menopause research, and there was some research in older populations, which is why I think we've seen a bit of a boom in creatine supplementation. Can we touch a little bit on menopause?
Exactly. I mean, menopause is it's more related to you thinking about like the brain fog and the cognitive health during the perimenopause or menopause period? Is that mostly what you're referring to?
Yeah.
So from definitely a brain health, because creatine doesn't help with like the hot flushes and all that sort of stuff. But from a brain health perspective, a lot of the evidence now is showing that creatine is extremely beneficial for people with established conditions, or rather than necessarily being able to prevent conditions. Good examples are if someone has a brain injury or a spinal cord injury or have dementia and issues with attention or memory, adding creatine can actually improve function, improve brain performance, whether it be memory or attention. But in terms of using it over a longer period of time to prevent those conditions, the evidence isn't as strong for that yet. But in a reactive manner, it's very good. Another thing to appreciate is a lot of the evidence is also based on stress. So me, for example, we have a young son at home. We're about to have a second child. So creatine's got
less sleep too.
It's exactly right. So if I'm losing sleep, if I've got a lot of physical or psychological stress that's impacting my brain health, creatine can improve my cognitive performance in that situation. But it's not going to take me from 0 to being like superhuman. It's pretty much the efforts. But if you're suffering with stress or an actual condition, it can be very helpful in those circumstances.
I think for women as well, because you usually just don't have as much muscle mass for the creatine to be absorbed into the body. So for women, it could actually be even more beneficial for them if they are taking it, even though the weight gain is only going to be for a short period of time, just as fluid, like you said before, and then over a period of time, it actually tapers off. And you get all the performance benefits of it. You don't technically need to do the loading phase, do you?
I don't. I very rarely load. I just find it's too much. Then, well, how long? And is it 20 grams? So for me, it's often 5 to 10 grams. So it's about half to a tablespoon per day. I personally use 10 grams a day. But it's about half to a whole tablespoon. So it's pretty easy to remember. And it dissolves in water. You can have it in water. You can have it in a shake. It's pretty convenient too.
Yeah, I literally just spoon feed it in. Just wash it down with water straight and then go again. Any timing that might preferably need for it?
For me, it's just getting it in consistently. I don't worry too much about whether it's pre or post, or as long as you're getting it in consistently, that's more important.
Yeah, awesome. Is there anything else you'd like to touch on with creatine from that respect?
Not really. I mean, very low risk, definite benefits for brain health and for physical performance, and then but just be mindful of the certain situations where you have to be a bit careful.
With that, cancer, does that come into play as well? Can creatine actually, would there be an enhancement in cancer because of it?
Good question. I mean, mechanistically, if cancer is using a lot of anaerobic, so non-oxygen dependent metabolism, potentially, but I actually don't know the evidence on that. Something I have to read up on.
I haven't seen much either, so I'd have to look that up as well. There's something maybe we could follow up on, because it would be interesting. Again, mechanistically, as you say. Awesome. Thanks for that, Dr. Seb. And thank you again for listening for creatine on our Rapid Fire, the Long Jev Lens.